Hi, my name is Vidisha Gupta. I am your host for today, and I welcome you to today's podcast, Win Over Hypertension. Through which you can learn how to take control of your high blood pressure through exclusive insights and practical advice. And today, we're talking all things about hypertension, why it matters, how is it caused, and most importantly, how to manage it effectively. Hello, doctor. It's my honor today to welcome you on this podcast, Win Over Hypertension. And I guess today we will be needing all your insights on how to manage high blood pressure and hypertension.
Hello everyone, I am Dr. Rajiv Mukherjee, consultant physician from Kolkata.
Okay, doctor. So my first question to you today is, we all know what hypertension is, but can you please elaborate on it? I mean, why is it so important that we take care even when we are feeling fine?
As per WHO, almost 4 out of 5 persons are living with hypertension inadequately treated despite having the risk factors.
Doctor, why is it so often called the silent killer? What makes it so dangerous over time?
Why is it called a silent killer? Because it often causes significant organ injury before we can understand what we have been through. It affects the heart, the brain, the kidneys, and probably all the organs involved with blood circulation. Hypertension over a period of time causes the arteries to be more hard and less elastic and leading to organ injury in its course.
How is blood pressure really diagnosed? Can you please elaborate on the exact numbers patients should look at by looking at their blood pressure readings?
As per American Heart Association, 120 by 80 millimeter mercury is the normal blood pressure of an individual. Anyone who is having blood pressure more than 130-80 millimeter mercury will be diagnosed to have hypertension.
Okay, so for someone who's just been diagnosed with high blood pressure, what are the changes you would want them to make in their lifestyle first?
The risk factors for hypertension, who is going to get hypertension, it's very difficult to comment, but actually lifestyle risk factors, lack of exercise, our faulty diet choice, stress, addictions all lead to hypertension, though some renal diseases and endocrine diseases also cause hypertension, which we call a secondary hypertension.
So can we say that hypertension can be treated without medication also?
It is obviously the medicines along with lifestyle modification. How can we modify our lifestyles?
Okay, so while taking medication, what are the most common side effects people should look out for?
We have to reduce our stress burden. We have to reduce our addiction burden in the form of cutting down smoking and alcohol intake. We have to make a prudent diet choice, which includes more of vegetables, fruits, lean proteins, whole grains, and low-fat dairy products. We should never forget about our salt intake. It has to be less than 2.5 grams a day. It has been seen that by reducing 1 gram of salt intake a day, we can reduce our blood pressure by 5 to 10 millimeter mercury a day. Again, we have to keep in mind our body weight.
Okay, so now my question would be, if somebody's blood pressure improves, can they come off medication or it's a lifetime commitment?
We have to adhere to our medicines as prescribed by doctors. If we have any complications, we have to inform the doctors so that the medicine can be changed or the dose can be adjusted. If anyone experiences any problem with any new medicine, that problem has to be informed to the treating doctor so that the doctor can reduce the medicine or change the medicine with another class of medicine. But one should never take the risk and responsibility of stopping the medicine entirely on his or her own.
What can happen if high blood pressure is untreated for years? What are the body parts which are most at risk?
We should not forget that hypertension alone causes almost 10 million deaths globally per year. So we have to be more careful to know our numbers of blood pressure. We have to eat healthy, we have to move more, we have to cut down our addiction, and at last we have to adhere to our treatment to live a healthy life. And one thing we should never forget, alone lifestyle modification, alone healthy diets and any healthy supplements can entirely control blood pressure. It has to be the medicine supported with lifestyle modification, exercise, and yogic practices that will help to control blood pressure better.
So this marks the end of our podcast, Win Over Hypertension. I would like to say a huge thank you to our doctor for such valuable insights. Remember that hypertension isn't just a number, it's a signal, and with right practices, we can manage it effectively. Like the podcast, please don't forget to like, share and subscribe and leave a review for us. Just remember, stay informed, stay proactive, and most importantly, stay healthy. This is Mukherjee Gupta, your host, signing from the podcast, Win Over Hypertension.